Health officials in 3 provinces continued to monitor a salmonella outbreak, which is linked to recalled salami. 72 people are confirmed to have fallen ill with this, 57 of those cases in Alberta. And these are the different products that were recalled on June the 10th. Hot and sweet Genoa Salami from the Rhea brand and mild Genoa Salami from the Bona brand, all affected, sold in grocery stores in Alberta, Ontario, and Manitoba. But they also may have been sold, this is the government warning, in sandwiches, unwrapped, sliced, or in sandwiches at deli counters. There are 14 cases in Ontario, Manitoba with 1. No deaths associated with this, but 7 people have been hospitalized. So we thought we'd spend some time looking closely at this, the health repercussions of all of this. So those are the products recalled. But again, salmonella at the root of this. So Dr. Samir Gupta is here, respirologist and an associate professor with the Department of Medicine at the University of Toronto. We keep moving your day, but thanks for coming in on a Thursday. We're having these extra interesting stories. So contaminated salami, how does a food like salami become contaminated with salmonella in the first place?
You know, a few different ways, Heather, and meats can be affected by this particular foodborne illness. Look, sometimes the animals have salmonella. So in the process of butchering and processing the animal, the meat gets contaminated with the salmonella that's in the intestinal tract of the animal. Then it goes into a batch, it gets mixed, and you have an entire batch that gets contaminated and then packaged and out to many provinces. It could also be the casings. Don't forget that in some types of sausages, the casings are made of intestines. So if the intestine, the casing itself is contaminated, again, that whole batch can get contaminated. Sometimes the equipment in these, where this is produced, is actually contaminated, and that may also result in a large batch contamination. And sometimes it's the food workers. So they have access to, again, you know, all of this equipment, all these batches, and if they're not properly hand sanitizing, whether they're infected or in some cases they might even have asymptomatic carriage of salmonella, they can infect that batch, and then on it goes from there. On it goes
to us, and now we're talking about 72 cases and 7 hospitalizations. When a human, then when we ingest this, this product that is contaminated, what does it do to the body? What does salmonella do?
Yeah, it's an infection that mostly infects the gastrointestinal tract. So depending on how much you've consumed, the more you've consumed, the sooner you'll get sick, and the more sick you'll get as soon as 8 hours after consumption, up to about 3 days after consumption. People will typically get diarrhea, usually watery diarrhea. It could give abdominal cramps, could give nausea, vomiting, fever, body aches. Sometimes bloody diarrhea, but that's less common. You might see it in children in particular. Most people get through it. They get over it within a few days, you know, 4 to 10 days.
Uncomfortable, but...
It's uncomfortable. You get through it. Most people won't seek medical attention. So this 72 number is likely tip of the iceberg. A lot of people don't realize it's salmonella. They get through it. There are groups that are more susceptible, like in every infectious disease, particularly kids under 1, adults over 50. We tend to treat those, and most people we don't treat. We let the infection take its course. But those folks we treat, people who are immunocompromised, weaker immune systems, we treat them as well.
And would that be something that would lead to hospitalization? Or in the worst case, this can be deadly.
It can.
How does it end up with someone in hospital then? Yeah,
so it can get bloodborne. That's one of the reasons you might get really sick from this and require antibiotics. We'll often treat with oral antibiotics, but if you're really sick, there are also IV antibiotics for this. As you say, people can die, and you know, it's usually meat, poultry, eggs are the typical for salmonella, but we had this outbreak, I think we talked about it last year, in cantaloupe, and people had died in Canada from that. There's also this outbreak related to feeder rodents and reptiles, which has been happening for a couple of years in Canada, where people have these pets and they get salmonella from their pets. So there's a bunch of different ways people can get this.
This particular strain, when you mentioned antibiotics, if need be, the government information warning about this particular outbreak says that this is a strain that is multi-drug resistant to certain antibiotics, including things like streptomycin, kanamycin, ampicillin, etc. But there are other antibiotics that work. So that's not a concern. Does it complicate things a little bit if they're not responding, or if this strain doesn't respond to everything?
Yeah, so we don't usually treat. So milder cases luckily don't require antibiotics. It's the people who are more sick or in hospital where you're going to do the stool culture, and you will know based on the culture results what that bacteria is sensitive to. So luckily there are antibiotics that are still effective for those sicker patients. It does make it a little bit trickier, But as long as we identify that it's drug resistant, and then we move on to those stronger antibiotics, those people can still be treated.
Okay, and then the other point that caught the attention of our team is the whole transmissibility of all of this. The line from the government information again is people who are infected with Salmonella bacteria can spread Salmonella to other people several days to several weeks after they become infected, even if they don't have symptoms.
Yes.
What's the root of that transmissibility? How does that happen?
Yeah, so it's still this fecal-oral route. So you have the infection, and some people have asymptomatic infection. After infection, for several weeks, you are shedding the bacteria in your stool. So you have to be really careful with hand hygiene. And if you're not really careful, you can slip up. And if you have even a little bit of that bacteria on your hands, and then you're doing food prep, for example, within a household, it can spread that way.
Okay.
And so we have to be very careful with folks who are in food prep industry or folks who work with kids after a Salmonella infection. In some cases, we quarantine those folks because it's so transmissible for several weeks thereafter.
Like so many things, it comes back to proper washing of hands. We always reiterate that message. Dr. Gupta, thanks for coming in. Great to see you here on CBC Morning Live.